Thank you for joining us once again. It seems like we are still in the thick of the pandemic, and now we have a new variant upon us, which is changing week to week, month to month. Please explain what the new variant is and how it differs from the others.
Yeah, this variant, has everyone up in arms, and especially when it first was alerted to the general public, because this variant has the most mutations that we've seen to date on the spike protein of the virus. It has 32, actually. And the reason why this is worrisome or concerning to many scientists is because most of our vaccines target that spike protein. And the same goes for a lot of our therapeutics, as well as, antibody treatments. So that's why it was of concern that, is this variant going to make our vaccines and other treatments no longer work or work as well? So that's the concern.
And now we're also going into a third shot, the booster shot, for those that have chosen to get the vaccines. What does the booster do? And is it helpful with the new variant?
Yeah, that's a great question. And now we're finally getting some good answers on that. So what a booster does, and it's not just for COVID, we've used boosters for many years for tetanus, pneumonia. Some people even need them for like their measles, mumps, rubella vaccine. And what it does is exactly, as the name says, it boosts your immune system. So after time, it's normal for immunity to start to wane or drop a little bit. And what the booster does, it kind of gives you another surge of antibodies. It makes your T cells, which are also very important in fighting viruses, makes them kind of more immune, remind them again about this virus and how to fight it off. So with the Omicron variant, actually, the news is promising that it appears that with the boosters, people are still very protected, especially against severe disease, hospitalizations, and death, which are the worst outcomes from COVID-19. And we're even seeing Pfizer release some data a couple of days ago that even with the 2 shots, your T cells are still look like they're able to fight the virus. But then with that 3rd shot, it's even better. So initially, when we were looking to see how well the vaccines would work with this new variant, there was a little drop in antibodies. South Africa found that, Pfizer found that, some other independent scientists also found that. And the good news is now it's looking with that booster that drop is kind of compensated for, if that makes sense. So that's why now it's being recommended that everybody go get their booster. Before, it was only certain populations or high-risk groups.
And I've heard amongst a small population of friends, and obviously it's been reported, that some people get side effects from the vaccine. I've also heard people who have gotten the booster and they're having similar side effects to what they had in the beginning rounds of their first vaccines, whether it's fever, chills, just feeling overall fatigue, not well, and it's usually takes them out for 1 to 3 days. Is that something that when people are considering going for their booster, that they should just schedule in their week?
No, that's a great question. So, I mean, for the most part, people either have a very similar reaction to shot 2, which for a lot of people was more symptoms than shot 1, or some people are lucky they get a better immune response. But, if you're someone where you're not sure how you may react, or you reacted pretty badly to either of the first 2 shots, I would recommend giving yourself some time to recover from the booster. Normally, it doesn't take more than 24 to 48 hours. So you may want to plan it right before a weekend or before a day where you don't have to work or not be working as hard. That way you have ample time to recover from the expected side effects.
In the state of New York, just recently, there was an order that said for businesses that they would have to have customers either mask or vax and present a vaccination passport, or they could face a fine of $1,000 as the business owner. Being that this is wintertime, is this at all surprising to you, or is this when viruses really can spread like wildfire in an indoor setting?
Yeah, being that it is wintertime, I think it's actually the move makes sense because viruses do spread more indoors. We know masking works from last winter because normally we get ravaged by flu. Hospitals are overwhelmed. People are getting very sick. And last year there was barely any flu cases because everyone was masking. Everyone was very proactive and got their flu shots early in 2020. And so, the same logic applies here, that not only will it keep COVID cases down and reduce transmission, but it will also help prevent other respiratory viruses that are also running rampant right now. I'm vaccinated, but I think I'll still mask indoors, even though there is that option, because why not? Especially in public places, it only protects you more.
There's also the vaccine for children between the ages of 5 and 11, I believe. Is that correct?
Yes. Yeah. It was approved about a month ago, or a little over a month ago.
And for parents that are considering, and I see this all on social media, there's always very polarizing opinions on this, just as it has been with the onset of COVID since beginning. How does the vaccine affect children, or does it affect them at all? Do they still have maybe some of the side effects that we just talked about, the chills, the overall not feeling well, needing a couple of days off? What should parents know?
Yeah, actually, so it's interesting. Some kids do have similar side effects to adults, but a lot of children, including, children of friends and family that I know, actually had almost no side effects. Like they had a sore arm, but many did actually very well, even better than adults. And it might be because that pediatric population actually gets a lower dose of the adult dose. They get almost a third. So they tend to not even have as many side effects as adults. But, the usual things can occur. And again, it's 24 to 36 hours, but then they're back to normal. So, headaches, fever, body aches, but kids get those side effects with other childhood vaccines as well.
I have been seeing signs, and obviously not trying to get you into any kind of political discourse, but signs that say unmask our kids, or mask our kids. From a purely scientific standpoint, what is your feeling on masks indoors with children, especially during this time of year?
Yeah, so one, I don't know why masks are political at all, so it doesn't make any sense to me. But if you look at the science, children who are old enough to keep a mask on, they actually benefit from having it on, especially during the winter months, especially when they're indoors, because children already pass around viruses, germs at such higher frequencies. It's a joke that we have, but when you can tell when back to school season occurs, because everybody's getting sick, not just the kids, but they're bringing everything home to everybody else in the family.
Yes,
and it's because they pick it up at school. They're sharing stuff, they're sneezing all over each other. So, to me, it makes sense. Of course, if there's a very, very young child, like under the age of 2 or 3, who can't keep the mask on, that's a different story. But for the most part, not only will it protect your child from COVID, but everything else that they could get right now, flu, RSV, which actually is very dangerous in children. And we've seen a spike in those cases too. So I don't see a downside from a purely scientific standpoint.
What is your sense on how COVID is going to peak this season? Do you think that we'll be in potential lockdowns? Do you think that we'll be quarantining again? Or is this just continue with the plan, which is, state masks, depending upon your state regulations, and vaccinated? How do you see this playing out?
Yeah, I think one, winter, we're expecting a surge of COVID cases even before this new variant, because that's just what happens in the winter. Respiratory virus cases go up and hospitalizations go up, et cetera. But I think we're still in much better shape compared with last winter, because last winter we didn't have a vaccine readily available, and we didn't have all of these other therapeutics under our belt. So, we had monoclonal antibodies, but we didn't have now these pills that you can take within the first 3 days of getting sick, which also dramatically reduce symptoms and keep you out of the hospital. So I think we're actually in much better shape, that we might not need to go to such an extreme as a lockdown or quarantine, because now we have the vaccines and we have so many other therapeutics that even if you still get sick after the vaccine, that you're covered.
All right. Thank you so much. I'm glad that we have a better understanding of what's going on, because as always, knowledge is power, and it helps to alleviate any unnecessary concerns.
Yeah, no, I'm glad to help. And as you know, with this pandemic, things keep changing. So
Yes, yes. And I hope one day you'll be here and we'll be just talking about how healthy and wonderful and how so long ago that pandemic was. And can you believe we lived through one versus actually living through one presently?
Yes, I hope so too.
And thank you. And thank you to people such as yourself, the healthcare workers that are doing the work to keep us all safe out there. So happy holidays to you.
And happy holidays to everybody. Stay safe. We have all these tools now. Let's use them.